Next.
Hi, I'm Hollis Silverman,
And I'm Dr. Bruno.
and today we're going to be discussing female and male arousal disorder. So just to start off, female and male arousal disorder is a complex, hardly understood condition that ranges from all ages and all ethnicities. So when we talk about female and male arousal disorder, there's actually different symptoms that go along with women, and there's different symptoms that go along with men. So Dr. Bruno, when talking about female and male arousal disorder, I'm going to start by talking about females. Okay. And I've actually never announced this on our blog before, but I am a certified sex therapist. So this topic is not, news to me. This is actually something that my patients come in and talk about actually more often than even is really evidence-based reported. So a lot of times people are very embarrassed by this, as you can imagine, because some of the symptoms that come along with actually both female and male arousal disorder are they have basically very low sexual desire. They don't really experience any sexual thoughts or sexual fantasies. And even as I call them with my patients, I call them sexy thoughts. It's very little to none. And with women, what ends up happening is they basically want to avoid sex at all costs. So whenever they're in a sexual encounter, or if they're having some distress or interpersonal conflict, they will do whatever they can to avoid sexual intimacy.
So who usually initiates therapy?
That's actually a very good question. So if it's the couple, it depends. I would say that it kind of ranges. It could be both, but definitely probably the partner that is not experiencing the issue. Because
so frustrated, they're both frustrated. So that's all right, yeah.
Yes, they're definitely both frustrated. Yes, but probably the one that's not experiencing it because either they're maybe worried about their partner or they're very stressed out with the situation that's occurring. So and the person that's experiencing it usually is very embarrassed and may have some shame or some guilt, as you can imagine. So they're a little bit more timid to report it.
So when someone comes to you or a couple comes to you, what is your first recommendation?
My first recommendation is to rule out a medical condition. So when I see my patients, the first thing I tell them is to go get a physical examination by their doctor. And then once that is, ruled out and there's no physical condition, medical condition, then, psychotherapy could be very, very helpful, and also other, forms of treatment.
Is there a specific psychotherapy? Because I know, some people might, and I immediately think of Masters and Johnson.
Yes.
So do you do Masters and Johnson?
Yes. Sensate focused therapy, on the money. So sensate focused therapy, as a sex therapist, that's what I've been trained upon. So it ranges from anywhere from 10 to 12 sessions, and we work with the couple together, and then we give them separate homework assignments. So even if one of the partners does not have an arousal disorder, they can still do the assignments with their partner, and then they can also do the assignments on their own as well, just to give that partner support and help them feel validated.
Now, I want to clarify this because I know some people are thinking of it, but they don't want to ask it.
Okay.
Nothing actually happens in your office, right?
Yes, I'm so glad you clarified that. Nothing happens in the office. Absolutely not. It is strictly professional, ladies and gentlemen, and anybody else. It is just strictly talk therapy.
Okay. So what are some of the medicinal therapies?
So I would say you can use, PSE5 inhibitors. So for men, that's going to be, Viagra, Levitra, and Cialis. Also, for men and women, you can use SSRIs, which antidepressants. So that can be a range of different medications, Prozac, Wellbutrin, but there's a variety of different SSRIs. Also, testosterone is going to be very key in terms of arousal and low sexual desire. So there's creams out there for women, and there's also men can get injections of testosterone by their urologist or by their healthcare physician.
Okay.
Yeah.
I guess for final, what causes it? You know, why does someone have this issue? What brings it about?
Great question. So different causes, so physical causes and then psychological causes. So obviously, as I said before, if there's a medical aspect to it, the physical, for a man, it's going to be vestibular system diseases, or it could be diseases of the nervous system, heavy smoking, so a lot of nicotine use, heavy drinking, poor lifestyle choices. If somebody has has obesity, or they're not exercising, those things can definitely contribute to arousal disorder.
And age?
Age, 100%. Yeah.
What is the age for men, like when it starts to get a little more difficult?
It depends. It depends. I mean, I would definitely say, it could late 50s, but as I said, it ranges from all ages. So even I've had clients that are in their 20s that have this issue. Okay. And maybe that's more situational, but that's why with female and male arousal disorder, this can actually happen. This can be a lifetime issue, or this can be a situational issue. So this could happen at the onset of the first sexual encounter that person has ever experienced, or it could be situational. So interpersonal conflict with your spouse or your partner, or just maybe you haven't found anybody and you're kind of, jumping from maybe partner to partner, and this sort of thing is happening. But that's
stress.
Absolutely. Stress in our everyday lives can cause this.
4 kids.
Yes. Yes. I mean, of course, kids are stressful.
I kid.
So, I would say that, talking to a therapist, talking to a doctor, getting their 2 cents on this issue, most of the time, and especially a certified sex therapist or a sexuality counselor can give you further insight. Getting to know your body in general, just being educated on yourself is going to be helpful in treating this. This is a treatable disorder. It's just going out and really getting the attention from somebody that has the training, and it can really be useful.
So basically, the most important thing is being able to admit it to yourself and get help, because it is treatable.
Precisely.
Excellent.
On the money.
Thank you.
Thank you.
Have a good day.
Bye.